system or reimagine something new? Will healthcare ever serve consumers just like me and you? The power's in our hands, but every side's gotta come together. We want the newer generations to get something better. Until we flip the script and talk about what gets prevented. Until we see the changes permanent as if we meant it. Until healthcare is finally consumer-centered. We've got a lot to rap about.
Welcome back to the leading podcast about consumer-centered health. This is more than a show. This is a mission, y'all. As builders and operators, we're here to share with you the latest consumer-centered ways that healthcare is being designed, marketed, and delivered. And as consumers yourselves, we want you to understand how these options work and why they might be right for you and your loved ones. Here's what's going down today. First up, our newest shout-out goes to consultants who are helping to guide conversations and bring clarity. Then we wrap up our series recorded live from HIMSS 26 in Las Vegas. Today, we have a full lineup from health IT and health tech solution providers who spoke with me on the exhibit hall floor about solving some of healthcare's legacy data challenges with emerging tech. Pay attention, here's the full lineup, y'all. First, Anurag Mehta, CEO and co-founder of Omega Healthcare, cuts through the challenges of having too many tools and revenue cycle and not enough clarity on what actually works. Then Shawn Fichter, CEO of Legacy Data Access, describes how to reframe the way that we collect more data than ever and then make clinicians hunt for it. Next, Elton Tavenner, Chief Technology Officer at Certilytics, shares how to flip the narrative from how to use AI to how to get better answers from data we can trust. After Elton, we hear from Vik Sheshadri, CTO at MedTech Solutions, about how access in the workflow is still the real issue. Then we hear about hospitals without walls, isolated recovery events, and strategic cost optimization from John Tonthat, Chief Revenue Officer at Cellhub Enterprises, and Wes Rhodes, Strategist and CTO at Freeman Health System. After that, McDonald, co-founder and CEO of 86Borders, shares what actually drives meaningful member engagement, especially for vulnerable populations. Next, Mikhail Golovnya, Senior Advisor Data Scientist at Minitab, offers a much-needed reality check on where we actually are with AI today. And to wrap up the episode, we learn what it takes operationally to make AI successful on the ground from Solventum's Bala, Chief Technology Officer for Health Information Systems, and Thea Campbell, Global Business Director for Revenue Cycle and Revenue Integrity. All of these full interviews are now available on the Healthcare Wrap and Healthcare Now Radio YouTube channels, so check them out there as well. And with that, I'm Jared Johnson. Let's get it. This week's shout out goes to the consultants, strategists, operators, builders, and advisors helping healthcare organizations think clearly and move forward. We're glad you're listening because the best consultants are helping leaders make decisions. You're often brought in during moments of uncertainty, transition, or pressure, and your value shows up in how well you listen, simplify, and guide. You sit between vendors and providers, vision and execution, ambition and reality, and the good ones know when to push, when to pause, and when to say, this isn't the right move right now. Healthcare Wrap appreciates consultants who care about outcomes more than optics, who prioritize trust over transactions, and who understand that healthcare change happens over years, not quarters. Thanks for being thoughtful partners, not just loud voices, and for helping the system move forward one decision at a time.
There's so many different AI companies that are out there today. And every time I turn around, there's another startup, there's another company, there's somebody that's developing something to try to make something more efficient in the revenue cycle. And it's hard to kind of decipher who's got something that's going to work, who's got something that's going to actually provide value. And if you're sitting there and saying, I'm going to try to pilot this and try to pilot that, I think there's a lot to sift through. So I think one of the hardest things in our space and revenue cycle is knowing what works and what actually you should try yourself, right? And I think if you look at different health systems and they don't have time, they don't have the resources, they don't have the manpower to say, I'm going to try these different 10 solutions and I'm going to put a team on each one and I'm going to figure out how this is going to work and then I'm going to buy the tech and then make it work. We all know that health systems should be focused on delivering care and not on the administrative side of this business, right? So when you're taking resources and time away from doing the clinical aspect of it and trying to put it into the administrative side and trying to figure it out, that's a difficult thing to do because that's not your core business. You have to work with companies that can try to bring that entire solution to the table that says, I will take this off your hands. I will build the best technology for you, and I will do the human in the loop component so that you have the entire solution and you're not just buying a technology and trying to figure out how to use it. Agentic AI for me, at least things that I've seen that are working right now is, so when we call a payer, we actually have the agentic AI listening to the agent. And it's then prompting the agent to make the next right move with that payer try to get the claim resolved in one touch. The moment you have to touch it the second time or the third time, it costs a lot of money. So if you can figure out ways to make it better and more efficient by guiding that person to make the next best move, you're creating efficiency, right? The other thing that you're doing is you're listening to the call the entire time. And as the agentic AI is listening to that call the entire time, at the end of the call, that person doesn't have to sit there and like, okay, now I better summarize what I listened to. The summary is done, right? So then that's a lot of what you can see on, your phone, or there's so many different apps for that today. But that is the type of thing that you're getting now into the agentic AI piece, is you're making things more efficient by utilizing the technology that is at your fingertips to make things better and make your outcomes better. Today, I'm seeing a lot more around agentic AI and utilizing technology to kind of do the human component of it that's being done today, where you can get claim status or you can talk to payers. You can do things that are more utilizing bots and agents. And now the payers also have bots and agents. And I think we're going to be in a point where bots are going to be talking to bots soon.
The legacy data paradox. Information is key. We want information. We want information to make the most informed decision that we can, but we keep on siloing all this information. We put it in different pockets. We put it in different systems, and we make those decision makers, the practitioners, your HIM, your clinical informaticists, we make them hunt for the information. So let's think about this a little bit differently, and let's bring the information to them and make it as easy as possible to access the information that they need in a day-to-day, minute-by-minute business setting to make the most informed decision. The headache in health systems is they're under pressure. You've got requirements on the meeting times. You have 17 minutes per encounter. So everyone's tracking how effective we are and how we can move patients through an encounter. But then we have to ask those practitioners to go look for information to make a decision to get through the encounter. So we're putting this information all over the place, and we're asking folks to go faster and find it quicker. Why are we making it more difficult? I was just having a conversation with a surgeon last week. He spent 2.5 hours looking for one piece of information for an upcoming patient visit. It took him 2.5 hours to go back into the archive to find critical information so that he could prepare the best care plan for that incoming encounter. Pajama time, clinical burnout, HIM managers, we go to conferences that are bringing in therapists to talk to our practitioners. Let's actually think about what they need, and let's actually build systems that make their lives a little bit easier. If we connect the patient record, if we think about the archive, which is clinical history, and bringing it to that decision point at the bedside in the care planning, then we can allow that practitioner, that expert, to move on and get through that decision-making process a little bit quicker. Let's think about making a decision on limited information versus all information. So if you're going to make a care determination, or you're going to make a billing determination, or maybe you're going to resubmit a claim, but you only have a limited data set versus all the information possible, how do you think the probability of that success is going to be? So what we're looking at and what we're focusing on is bringing all the information possible to that point of decision, to that point of care, so that you see the full scope, not just part of it. So if you're coming in with a shoulder problem and you've had this shoulder problem for 5 years, but you're only looking at 1 year of history, what are we doing? How are we looking at the best care plan? Care is one thing, but you think about adjudications for billing or resubmission on claim status. Look at the total picture. That's what the archive has. You're making a determination on just what's online. There's a bigger world that you can make a better decision for. Context switching. We know that that's not effective. We've had so many experts through the past 50 years talk to us as business leaders that context switching is not an effective way of running a business. Swivel chair is the more commonly used term, where you're looking at different systems for different information, all to do one thing, and that's to make a determination and make a decision. So bringing these together and eliminating the fact that you've got to go hunt for information, that you've got to keep on looking around, let's all bring it to a consolidated point. That's the concept of interoperability. That's truly interoperating in that moment so that you can make an informed decision and you can move forward and you can keep on processing. Right now, we're forcing our leaders to keep on looking for this information just so they can get to the job that they're hired to do, make the decision, a care plan, a bill, submission, a claim, whatever it might be, an intake. We're looking all over the place just to do one thing. We don't have to. all the technology exists that we can bring this together. So the focus that we have from an archive standpoint is to connect this information so that you don't have to keep on looking for it. We don't want you context switching in the moment. We want you to be single focused, move through that process, and then get on with the next one. AI is here. Everyone's talking about it. What do we do with it? How do we actually employ that? Think about the archive as a learning data set. It is what you did yesterday. The tagline is yesterday has so much to teach us. AI wants to learn. It wants to learn continually. Your archive and your archive provider has all of your information that you just got done working on. Give it to your AI processes, your initiatives. Let it learn in your world in a safe way. So think about that. And when you're looking at how does AI going to improve our business operations, you have a huge training set if you talk to your archivist. I think what I'm challenging healthcare leaders is to rethink what they do with an archive standpoint. It used to be compliance and regulatory. It's very, very powerful. So I'm asking them to ask me the questions. How can you make me better?
Certilytics at its core is really an answers company. We exist to provide answers. And we do that by providing really foundational data platform where we create a lot of trust in the data by bringing that data in, cleansing it, enriching it, curating it, and then we're providing AI tools on top of that in order to make that data available to healthcare organizations in a real meaningful way. It's been a very interesting journey over the last several years here with the advent of AI. But I think what's unique about Certilytics is that we've been an AI from day one company. So we built our platform to ingest data at massive volumes and to be able to apply the latest in AI, machine learning algorithms in order to get the most out of that data. And now with the advent of the new LLMs and the generative AI that's out there, we're able to just leverage everything that we've built upon that trusted data layer and then just produce something that's uniquely different. At HIMSS 26, we're announcing CertHLM. So Certilytics has always been an answers company. And we've spent over the last decade producing a platform that allows you to ingest data. And CertHLM builds on top of that foundation with a simple to use interface to be able to get to those tough answers a lot faster. So I think today healthcare organizations are dealing with a really complex, overwhelmed data problem. And tools like CertHLM and Certilytics help them deal with that. When it comes to using AI, it's all about trust. It starts with the data foundation. The trust of the data has to just be bulletproof. And we've really done a great job of creating that bulletproof trust here at Certilytics by the platform that we have that brings in that data, curates it, and makes that data available in very meaningful ways to our clients and the questions that they might have. And the second part is it comes into with our subject matter expertise that have put countless years of expertise into that system, starting from the infrastructure, the security, the healthcare expertise, actuarial expertise, clinical expertise, and the data scientists. So we've embedded all of that human knowledge into this system of curating data, just leads for a foundation of trust of the data itself. And then finally, for AI and LLMs today, you really have to be able to go back to that trusted data. So when it gives you an answer, you've got to be able to know where that answer came from. And so with our tools, we're able to cite back to those sources. So you're able to very easily traverse from the answer that the application gave you to the data that it came from. For healthcare organization executives, I think they're really looking for three things. They're looking for speed, simplicity, and trust. They have difficult answers that are being thrown at them every day, constantly, and they need to be able to get to those answers quickly. They need to be able to use a tool that's really easy to use, something that they can just go in there, natural language, ask the questions, and then get back the responses that are foundational in their data. And then they've got to have trust. They got to have trust that the organization that they're working with, that the data that they're working with has put in all of the rigor into their systems to make sure that data is correct and accurate. So I think in a nutshell, executives, they don't need more data. They don't need more dashboards. They need to shorten the time from question to answer. And I think that's what we do with CertHLM and Certilytics.
CareBridge is our integration engine. It allows us to connect disparate systems, bringing data together to serve inpatient care. The promise of digital health was to make things easier for clinical workflows. But as we started to silo data and put them in different systems, it really didn't serve that purpose. So bringing all that data together, making it available at the time of patient care is really critical in the process. And that's what CareBridge does. It allows us to bring system data together, put it in front of the clinical workflow when it's needed, and empower patient decision-making. CareBridge is vendor agnostic. It allows us to address interoperability barriers with different vendors by providing standards-based integrations. So all of the common healthcare standards and the new FHIR-based standards, new API technology that's being absorbed into healthcare, CareBridge supports all of that. So whether I want to stand up an API of my own, I want to connect to a vendor's API, I want to do things with old HL7 2.x messages, we can support all of it and make those connections so that you can bring that data together. So one of the barriers to building integrations is the technical complexity in doing so. Dealing with these disparate data types, translations, enrichment that needs to occur. Often organizations are resource strapped. They're unable to provide the number of resources that are necessary to build all the integrations that they want. And so with our new release of CareBridge, we've introduced an AI agent to help you with that process. So the AI agent allows you to query the system with natural language, and it can build complex SQL queries, different scripting to achieve complex solutions with simple natural language queries that most of your team can do on their own without having that detailed expertise. We're very excited about the solution. We think it'll make interface builds into minutes from hours and simplify the entire process. So as you're dealing with multiple different systems, understanding data structures, being able to know where data resides is a complex process. What the CareBridge AI does is it allows the AI to interact with the data model and learn that for you. So you don't have to know all that going in. You can ask simple questions like, give me a list of patient medications, and the AI will work with the data model to determine where that data resides. It'll then give you back a complex query that will return that information for you. It makes the job a lot easier. It makes the technical hurdles required to do the integration easier, and it makes your team more efficient. So there's a lot of buzz about AI, a lot of promises, and people are starting to see some benefit from it. With CareBridge, we wanted to make AI useful right away. So we focused on what can we do with AI that would really benefit the end user, and that's making complex things easier. So with CareBridge now, you can query with natural language, ask the AI to do things that you want the integration to do. And then the AI will build the scripts and the SQL that's necessary to be able to accomplish that.
From our point of view, Hospital Without Walls is just that. It's the ability for hospitals to deliver services where you're not bound by the physical location of the hospital. I think that's been a dream for years, and it's been an elusive dream. But I think the technology stack now allows us to do that. And we're delighted to work with all manner of hospitals, from rural to urban hospitals, to solve for that very issue.
For me, it enables something phenomenal. At the heart of every person in healthcare is the relationship between them and the patient. And we want to take that relationship and change it completely. Today, the relationship is transactional. They get ill, they come to us to solve that problem, we solve it, they pay for the services, and they come back at a predetermined time or a episodic moment when they are ill again. That is not the way that we want to run that. We want to be with them the entire time. And so the technology now is here where we can offer them additional services, many services, to help them have a healthy life all the way through. We can monitor their health. We can see what they personally, so high personalization, what they personally want to achieve, provide those services, onboard other vendors, are part of an ecosystem of other caregivers that just don't quite work like we do, that can provide additional services for nutrition, for other things, so that we can monitor them and provide them the care no matter where they are. So it not only extends to the rural environment, but it follows them everywhere that they go. I kind of equate that to, I'm ready to move. It's the most traumatic thing in the world, moving from a house that you've been in for 20 years and going to a new house. is it really necessary to add to that trauma by saying, I now have to get somebody I've known, have a relationship, and have that be part of my stress? And the answer is no, because now the technology is there to make that person with you, to unlock the data that's already exists and share it with providers wherever you're at any time that's necessary, but also to have the familiar providers, their face, their voice, their care, their knowledge, and their style that you're used to provide that care wherever you're at. That's what I think this means to me.
I think historically, Hospital Without Walls has been compartmentalized to just remote patient monitoring and care. And when we think about what Hospital Without Walls can be, it opens up a completely different paradigm on how to deliver that care. An isolated recovery environment is a DR practice that Epic recommends as a best practice. So think of it this way. If there was, God forbid, a breach to a hospital, the hospital needs to have the ability to continue its operations. And an IRE allows Epic in the cloud to function in that scenario. And from a T-Mobile point of view, what we then supplement is think of it as an isolated recovery network, which then powers the clinical communications and other data services that's required for a hospital.
So when I think of IRE, I think about that it covers the one place that we are somewhat lacking when we think about our recovery platforms. When there's an event, we try and recover the things that we know that have been breached. Well, let's say that it was a ransomware attack. We're going to recover the system that we have. We're going to recover the data that was in question. But then we go to the network and we're going to use the old network. That's the typical things that we do. But it can be somewhat like taking a clean dish and put it into dirty dishwater, because you do not know if that network is impacted or not. Has it been compromised? The good thing about IRE, as John was just talking about, is it's now a clean, air-gapped, pristine network. So now you know without question that you've got a pristine environment. You put the two halves together, the data, the platform, and now the network. So I think it's a great thing.
Strategic Cost Optimization is a program where we help organizations, but particularly hospitals, find dollars to invest into transformation. Hospitals today are under a lot of financial pressure. And so when you think about adopting new technologies or adopting transformational agendas, the difficulty is finding those dollars. And so our process is a proprietary process that allows organizations to, for us to bring in CMDB data, TEMS data, candidly, cabinet file data, and give the hospital a forensic view of their network assets. And by doing so, allow hospitals to make intelligent decisions on how to re-architect and find savings. So we're delighted to work with hospitals of all sizes to do just that.
Engagement is such an important component of healthcare. At the end of the day, the patient should be the center of the healthcare ecosystem. And the barriers that exist oftentimes in the populations we serve, which are the vulnerable populations, exist outside of the four walls of a doctor's office. So they include things like the social determinant barriers. They include education barriers. They include things like food insecurity, housing insecurity. And if you can't solve for those barriers first, then the health plan member, the patient that you're talking to doesn't feel the need to connect with you about going to have a breast cancer screening or going for some other screening or going to an annual wellness visit because they're struggling to put food on the table for their family that night. So we have to take a whole person approach to member engagement. And by doing that, what we're able to do is establish a trusted relationship with that member. And once we've established that trusted relationship, then we can encourage a member to take the actions we know they need to take in order to get on the proper health plan. Human connection versus fully automated outreach is a very interesting topic, particularly with the emergence of AI and AI agents. At the end of the day, again, our company focuses on the vulnerable populations. Those populations are subject to so many barriers, but the population is also overall distrustful of the current healthcare system, distrustful of the government. And so when a fully automated system reaches out to them to tell them perhaps that it's time for a doctor's appointment or it's time for a breast cancer screening, and they know it's just a recorded word, it doesn't achieve the threshold of a trusted relationship. And by having an individual engage in a conversation with those members, with those patients, we're able to establish that trusted relationship. Quite often, our health plan clients ask us for our scripts. We don't use scripts. Our care coordinators and care managers to engage in conversations, ask the member how they're doing, and then stop and listen. So we try to encourage our team members to listen and then look to what the members are saying they need and then address those needs and then ultimately get them to where they need to be, which benefits the health plan, benefits the patient. So measurement of meaningful outcomes beyond the typical compliance metrics, the gaps of care, star ratings, HEDIS gaps, those types of things. At the end of the day, what I think everyone really wants is for members that have historically been disengaged in their own healthcare and in the healthcare system to get re-engaged and therefore get on a path to better health. Oftentimes, it's not because they don't want to. My simple premise in founding this company was that no one, regardless of their socioeconomic status in life, chooses to be chronically ill. If you accept that as a premise, I don't know anyone out there that would not accept that as a premise. You have to ask yourself why members of these vulnerable populations are so much more chronically ill. So we have to overcome those barriers that exist and help people get to a better health path. By doing that, we will achieve the metrics that the health plan needs to improve their star ratings. We will achieve the metrics they need to reduce inpatient and ER utilization metrics and save them money. We will achieve getting the members in for annual wellness visits so that they can get the appropriate HCC codes based on the conditions and drive the appropriate risk adjustment the right way. I think the thing I'd like to share most is the emergence of artificial intelligence. Obviously, it's a major topic of conversation, and on so many levels, it's fascinating to me. From the inception of the dot-com era and as technology has emerged, technology has historically served to drive human efficiency. I think AI will drive human efficiency to the nth degree, which is great, okay? It doesn't mean that we will lose the need to have a human touch in member relationships, particularly as it relates to the vulnerable members. And when I say this, it's important to understand that this segment of the healthcare population drives an incredible amount of expense in the healthcare system. And so to the extent that we can leverage AI and technology to make humans more efficient, more effective, then we can engage people better, reduce cost, and everyone wins and have better health outcomes.
When you look at the modern AI landscape, there's a great misunderstanding of what AI can and cannot do. AI stands for artificial intelligence, but those who really know what AI is would call it amplification of intelligence. So there's a lot of confusion in so many minds of so many people because of the recent revolution that we experienced in machine learning, that they think that it's real intelligence. The problem is there's a first word, artificial. There's a reason why we call it artificial. There are things it can do, there are things it cannot do. And right now, I see a lot of noise, but very little substance. The next thing that will be, right now we've had, first we developed LLM models. We developed things like ChatGPT, conversational information retrieval, all of that. Then recently things have been pushed into agentic AI. Now there's a lot of question marks about agentic AI because true agentic AI would involve the development of artificial general intelligence, so we call it AGI. So this recent push into agentic AI may or may not work. It's kind of interesting. Things are in flux. But what I think the next big thing will be as people will realize that, wow, we underestimated complexity and we thought that we could do things that we actually still cannot do. So in other words, we flew to the moon, but we are thinking that now we can fly to the stars and galaxies. It's not that simple. The way I would characterize the AI stage right now, all of the new technologies, especially when we have revolutionary technologies and modern large language models, conversational retrieval are truly revolutionary. They allowed ordinary people, not necessarily computer nerds, to be able to communicate with the machines and get sensible responses back. So as any new revolutionary technology, it goes through the wave of hype. It's a natural thing, and eventually people will get more sober. They'll realize some of them will get burned on certain things that they expected that they didn't come to be. And eventually it will settle down. We'll discover what we can use it for and what we cannot use it for. So it's a natural thing. I would warn someone to jump all the way into that hype, because we want to preserve our investments, we want to preserve our customers, and we don't want to overpromise on what we can to deliver. So natural thing, just wait and it will settle down. Now, when we talk about predictive analytics, it's technically a form of AI, and it's been out with us for decades. It's very successful. It operates with numbers. It's very objectively defined. I can always decide whether I'm getting good result or bad result. I can always reproduce the results. So predictive analytics have already been very helpful in healthcare everywhere where you have quality data available. So the more companies will focus on quality data, the more they will be able to use predictive analytics in conventional setting, plus all of the modern language-based AI systems that can help summarize unstructured data, documented data, undocumented data, and all of that stuff. Okay, as far as harnessing the power of the data, what I've noticed, a lot of people are focused on collecting as much data as they can. And in fact, even if you look at the modern AI companies, like ChatGPT, OpenAI, like all of them, they're focusing on too much data to the point that we're pushing the data center capacities to the limits and everything. What I think should change, especially for those who are in the healthcare or like mortals like us who don't have billion-dollar budgets to collect data, is to focus on quality of data, to focus on getting the right data, to focus on getting the data that is actually helpful. So we don't want to collect data for the sake of collecting data, unless you want to pay a lot of companies that do that, data warehousing companies and others. But if we focus on what is right, if we focus on the data that's actually needed, that if we apply the true power of human intelligence into the equation, then I can guarantee you things will change. And there are lots of well-established companies like Minitab that will help you with all of the expertise and all of the knowledge that you need and provide the tools.
Hey, Thea. So I have a question for you. So what does it take operationally to make AI successful on the ground?
I think from an operational perspective, what we're seeing as we've evolved through the application of AI is you really have to start with a business case first, and then being very clear about what that business case is. Once you have that business case, it's really important then to look at your workforce and say, where are they at in this? How is this going to impact them? What is their readiness? And once you kind of have those foundational steps, you really are looking to what's your change management strategy? And I always feel like when I say that, people are like, well, no kidding. But it really is the key to that success. All of the things that tie into change management, in communication, being clear. And I think in that change management strategy is, what are your expectations of the staff, of the tool? What is sort of that iterative reporting? When are you going to see those results? And so if you really approach it in that business case with your workforce in mind, and then how do we facilitate this change like anything else, you really are going to hit those outcomes in a way that is going to be transformational.
What messages actually help teams feel supported during AI rollout?
Be transparent with them. What are our goals? Where do we see you in this picture? Where do we think this can be important to your transformation in the process? And having them be part of it. It's much better when you're doing messaging. You'll be much more successful if you're not just doing it to them, where they feel very activated with it. It's a double-edged sword in that space, right? If you're completely transparent with what's going right and going wrong, you then have to help them in the messaging of, look, we know that this isn't perfect. This is an iterative process, and we need you to put your value into this process to help us create a tool that's going to work. And ultimately, getting that commitment of, we want this to work. We want it to work because it should be important to you. It will be elevating what you're doing. And so it's, transparency is that key. Collaboration is key. And just really saying, this is iterative. We're all learning. And so it really is that commitment of messaging of, we're going to tell you like it is. We're going to include your voice in what is happening, and we're going to build it together.
Awesome.
So, Hari, what are some real use cases of AI here at Solventum?
Solventum, as you know, it's a 100-year-old company. It's a 3M spin-off, 3M Healthcare. And we've been in the AI space for many decades, right? Whether it is like rules-based, traditional machine learning, supervised machine learning, deep learning, and now agentic and LLM approaches. So we are right in the clinical productivity solutions, CDI, clinical document integrity, and the rev cycle, which is our crown jewel. In the clinical productivity solution, we are mostly in making clinicians' job a lot easy in the hospital setting. So we have like solutions for ambient speech and then dictation. So ambient is all about making doctors gain back their pajama time. So currently they spend like 2 to 3 hours every day documenting, post their work hours, and they get like doctor fatigue. And we completely eliminated by ambient speech to text and then like dictation to make the documentation part a lot easier. We have CDI, which is about like using LLMs to make the document more relevant and accurate by having soft nudges to doctors to correct the document to be coding ready, right? We are taking it to a level of autonomous coding. It used to be computer-assisted coding. Now we are taking it autonomous coding using agentic approaches, multi-agentic approaches, and automating the entire workflow and pathways. And then like push at least like 50% of the documents to coding. So that's where we are applying AI, all forms of AI, speech, large language models, and the latest and greatest approaches when it comes to AI for more accurate coding outputs.
What really makes us stand out from other competitors in that space?
The real advantage of company like Solventum, which has been in the space, is about understanding the clinical workflow.
Absolutely.
Right? So we have like close to 500 clinicians in-house who help fine-tune the models. The key is about how are you very secure, how are you compliant, and how do you be accurate when it comes to the results that's being produced. As you know, denials is one of the biggest problems. So our goal is to push accuracy is at the forefront, but also with all the clinical expertise and content expertise that we have built over years, we make sure there is clinicians in the workflow, human in the loop, to absolutely make sure there are less denials and more accurate outputs for the coders.